So we're sitting here today at the 24-hour posture conference with Rachel Wright. Delighted to have you here, Rachel.
Thank you so much for having me.
So we're recording straight from St James's Park, which is the home of Newcastle football. So there's going to be a bit of noise, Rachel, I'm afraid, because there's a bit of work going on here in the background. So you took part in the conference earlier, Rachel, and thank you so much for your great presentation. It was very personal and very emotional. So you're the founder and the CEO, would you say, of Born at the Right Time?
Yes.
Tell me about the name, first of all.
So that came from a conversation with my then 4-year-old, who is now 19, probably somewhere between 3 and 4. And he's sitting by the kitchen breakfast bar with a quizzical look on his face. And I was like, are you okay? Also, it was just, I'm just trying to work out why Sammy, that's his oldest brother, is the way he is. And I said, well, when he was still growing in my tummy, he wasn't so great and he wasn't getting enough blood to his body. And then when they got him out, he was a bit sick and they didn't quite look after him as well as they could have done. And so damage happened to his brain. So the parts of his brain that help him move his body and help him speak and help him eat and drink, all of those things were were affected. And he was like, oh, so was he early? Was it because he was? I think he was trying to in his little. I don't know where he got the idea from, but I think in his tiny little mind he was trying to work out whether he'd been premature, whether he had been born tiny. And I was like, oh no, he wasn't early. I said he was born at the right time. And the words came out of my mouth, and it was one of those moments I can picture where I am, I can picture where he is, and it was like this, like I stood back from that second, and I felt like, I kind of thought to myself, I wonder if ever I will think that he was born at the right time. From an emotional point of view, that actually because he said to me, he's like, well, why wasn't I born like that? And I said, oh, well, we got you out 2 weeks early. Like we did an operation, and when you were a couple of weeks beforehand, he's like, why didn't you do that with Sammy? I was like, oh, darling, if I'd known, I would have done. I know if I'd known. But there was something about that comment that was, my son was born on his due date. So he was born when it was planned, when it was expected, when it had been predicted it would happen. But everything that actually evolved from that moment was neither planned nor predicted nor as we expected. But I hope that one day I would feel like I could, from an emotional point of view, get to the point of it being the right time.
Well, tell us about Sam, because I know you told us a little bit earlier today, but so tell us about Sam. He was born, obviously, had no oxygen to his brain for a while and had to be resuscitated. And
so he had a really rough start and was in Skaboo for about 12 days. Those first 3 days, they laid out the potential complications. They sort of said, there was a good for the 48 hours after he was born. They were like, he might not get through this. This is, a serious chance that he's not going to survive. And then there was a glimmer of hope that he would be unaffected, although some of the clinicians at the time said absolutely not, he will be. And then there was this big grey in the middle that was like, we don't know what, but he's possibly going to have some life-changing effect to his, the consequences of his birth and the time before his birth. He's been one of those kids, young people, who's actually proved them all wrong, but unfortunately for the wrong reason. Hopefully he won't have, and then he did. Hopefully he won't be as bad as, and then it was much worse. So I've not got this sort of miracle story where it's like, oh, they thought he wouldn't, and then he did this. I know. Except the fact that he is nearly 21 years old, and he's still here, and he's
so he has no verbal communication, has he? Does he hear?
Yeah, Yes, his sight is impacted, his hearing's not impacted.
Right.
He loves music, he loves swimming. He has an obsession with the game show Pointless.
Oh.
I know. He will watch endless episodes of Pointless. He uses a switch to communicate or to skip his songs on. He can knows an Adele album from beginning to end. It can skip through the songs, the ones he wants to listen to with a single switch. But no, he doesn't speak with words. He'll tell you when he's thoroughly annoyed. His ability to say that in a polite way is more tricky for him to say no. Choice, he probably only has 2 choices, but because of a lot of hard work, he has a very full life of doing lots of things. So he goes swimming 3 or 4 times a week. He goes cycling in an adapted bike. He goes out for walks every day. He does art. He does crafts. He does music therapy.
Has he some hand function?
Yeah. So it's mostly to this.
Yeah.
He can bring his hands to his face. He can't grasp. We use all adaptations to help him to keep hold of something, to be able to whether it's hold a drumstick to make sound or whether it's to hold a sponge to. So we use lots of bits of kit to be able to support him. But he requires 24-hour postural care. So he has, as part of his support at home, he has a curriculum of every activity. We're thinking, what position is he going to be in? How long is he going to spend his time there? What's the function and the purpose of this? And trying to make sure that he changes his position every 2 or
And do you have a package? Do you have carers coming in? Have you been able to build that up? Because I know it's a struggle from the day one right up, but how has that manifest itself?
So it's evolved over the last 20 years. So right in the very early days, I think a lot of other parents, we were doing it all ourselves. And then the nights were really tricky. The nights were very broken. And eventually we got some night carer support because that just felt like walking through treacle, just not getting a night's sleep. And that ebbed and flowed. Sometimes it was much, much worse and then sometimes it was better and it got better and they removed the night carers and then it got worse again and we spent 2 years trying to fight for the night carers again. You don't really want people sitting in your house when you're sleeping. I mean, it's not that fun, but I can track the size of bags under my eyes by the percentage of nights in the week where we had night care support. And I managed to do a little bits of work. So he was then at school.
So just to recap, you are a nurse.
I am a nurse,
But you obviously, I shouldn't say obviously.
I was working up until I gave birth to my 3rd son. So 10 years ago, I was working up until 10 years ago.
So you kept working after Sam was born?
Yes. So I kept working after he was born. And then 10 years ago, when my 3rd son was born, 6 months after he was born, I published my book, The Skies I'm Under. And from that, that's where Born at the Right Time has evolved out of a kind of organisation aimed at supporting improving the lives of people with very profound disabilities, and doing that through supporting parent carers, through training practitioners, and through influencing policy makers and providers to try and change the infrastructure that supports families like ours, the people that we have to liaise with day in and day out, and also just a sense of we're not alone in this, which is what my podcast, The Skies We're Under, where we have voices of lots of other parent carers.
Is that what you who you mainly interview, other parents and carers?
Yeah, lots of dual perspectives. So like myself, lots of people who are parent carers, but also OTs, or parent carers, but also Sarah Clayton, CEO of Simple Stuff Works, parent carer, but also Lucy Parr is one of the other co-hosts, and she's an assistant educational psychologist. So lots of those dual perspectives, and we've had family carers of all flavours, but also bringing their expertise and speciality as well, whether that be around sensory well-being, or whether that be around postural care, whether that be around just education and legislation. And
so you say you do training. Do you actually put on training events?
Yes.
For parents and for professionals?
For practitioners.
For practitioners.
Yeah, so all of my work, majority of my work is about training professionals in listening to, communicating with and working with parent carers in a collaborative way.
And how often would you do that, and is that well supported? Like, do people come?
So we have managed to grow the business really successfully up until the last 6 months or so. It's the landscape is really tricky right now. We're struggling more than we ever have done. And I think the feedback from that, from whether that be in local authority or NHS, is that education budgets have been massively slashed. But we, as well as an online suite of courses, we're e-learning courses, we also deliver webinars that support practitioners, especially case managers around parent care trauma and wellbeing for parent carers. And then we also deliver bespoke packages. So that's the majority of our specialist work. Is I get an email from a clinician saying, can you come and speak at our conference, or to train our team around working with. And sometimes that's an inset day in a school. Sometimes there was a team over in Bury recently who came to us because they had their kind of CQC had identified that there was challenges between the relationships between parent carers and practitioners, and they brought me in and we did training events, and as a result of that they've made lots and lots of changes and trying to work better, and that on the micro level of the face-to-face conversation like this, how do you listen, how do you show people you're working with them, partnering with them, right through to the macro level, the kind of how the organisation, the team is built up, how the appointments are made, how the tone of the written information, the tone of the marketing or the whatever it might be, making sure that all those individual ways are supporting a really collaborative working and co-productive practice.
So when you say we, is there more than you on the team?
So there has been, we've just shrunk slightly, but yes, there's 3 of us that are part of the team.
And are they all clinicians of some sort?
No, so one,
or parents?
yes, so there's myself and Joe, who is a speech and language therapist and a parent. We've tapped into using the expertise, the model to keep us viable and adaptable, where we keep it as a small team, and then we, when we have a project or we have something going on, then we bring people in and pay them for their work.
And you were saying earlier your husband is a doctor. Is he still working full-time?
Yes, well, no, not full-time, GP. No. He hasn't worked full-time for years. We decided many years ago that we could really only manage full-time between us. That if for me to be able to work, yes. Yeah, that actually it just was not. And we do work much more than sort of part-time hours that culminate to more than a full-time job, but we carve out time. Weekends are hard. You've got kids that expect to have fun, you have expectations there's going to be family time, and you don't have the ability to of school to send them off. We realised quite early on that we needed time in the week when we had space away from kids yourself. And with each other.
Of course, that's still very important.
We try and navigate time off together.
What does Sam have, like work or somewhere to go now that he's 21? He's at that sort of transition stage, is he?
He left school. We took him out of school a year early because school wasn't serving him as well as we had hoped, and he wasn't getting his the provision he needed to meet his EHCP, the Educational Health Care Plan. So we took him out of school and started creating with a personal health budget through continuing healthcare. He has been, we developed a team around him, so it's a team that we manage. I have a kind of adopted daughter, so she's not in any legal way adopted, but she's part of the family. She joined the family, so she'd worked with Sam for a couple of years, and then COVID hit. And she moved in with us during COVID, and that was 6 years ago. She's not left. So she is very much part of the family and one of ours as well. Obviously, she has her extended family as well. And then she is a paediatric sister, so she was doing her training when she was part of, when she moved in with us. So she works at a children's hospice. So between her, myself and a Senko who was working as a PA for Sam for a while, we coordinate his package and provision. So Lucy is the care manager, so she employs the people, she does appraisals for people, she does the competencies, she does manages all the the off duty and the payroll and all those sort of things, as well as her job. I'm the one that works, kind of gives the oversight and looks at all the clinical side of things, so making sure the liaisons with the neurodisability team or the epilepsy team or the the orthotics and the wheelchair service and all those things. That's my responsibility. And then Faye, who's the Senko, works to bring in all the education targets to make sure that the development of the team is done, that there's training for the team, that we're not just keeping Sam alive, but we're giving him a fun full day. So we designed 8 weekly terms where he has some different stuff doing all day and into the evening. And it's all about whether it's in community engagement, his sensory well-being, his, like I say, his postures, and just having fun. So, going to cinema with friends or things like that. And part of that, so my mum's a nurse, a retired nurse, and Sam has always gone to theirs one night a week from a very young age. And he still does that. So his care team goes with him. It sounds
like a really, really busy household, though.
My goodness, there's 7 of us in the house, plus all the carers.
Did you have your house adapted?
A chocolate Labrador. Did we have the house adapted? So we have had it adapted. We did it ourselves because I had enough with trying to discuss things with the local authority. And so we paid for that ourselves. And it doesn't meet any of the criteria as far as having enough space or, just because, the reality of they would have taken more of our living room out to create the bathroom the right size for him, and we make do with the way it is. But it's probably not really big enough. Well, I know for sure it's not big enough for all of us, but it is what it is.
So your organisation is called Born at the Right Time, but your podcast is called The Skies Under.
The Skies We're Under. My book is The Skies I'm Under. That's my story of transitioning from a nurse on one side of the bed to a parent carer on the other side of the bed. And the podcast is about bringing that collective voice, understanding the collective stories of people so that we can feel a little bit more seen and understood, so that we can share information, so that we can bring in expertise from places and just feel like we're a little less alone. So that's The Skies We're Under.
And what has your your experience of the services been? Obviously, I get the impression that your experience wasn't great. Otherwise, you wouldn't have gone to all these lengths of writing books and podcasts and everything. What was your experience?
I think my experience was that of from a very early days with Sam, that, people might do new fancy therapies, or we might get a hospice day, a respite day, or we might get a specialist bit of equipment, or, school might put on something to try and make us feel better or feel supported in some ways. But I felt very early on that the single most important thing that that made a difference to my life day in and day out was the way that people communicated with us.
Right, okay.
The way that people, when I picked up the phone and spoke to somebody, whether they used my name, whether they were curious about how I was, whether they cared about the context of my family and cared about the ways in which our priorities were being expressed within what they were providing, that made a bigger difference to me than anything else. And so that's why I was passionate about bringing about the views and the lived experience and the understanding. And I could see it from writing my book. I ended up speaking at events and speaking at conferences and do training, and whenever I shared that lived experience, I could see the dawning on some of the clinicians' faces, because I've been in the rooms. I've been in the rooms when people have been talking about those heart sync patients and those challenging parents and those, you know, and I understand from a clinical point of view how frustrating it is when someone isn't engaging or isn't doing what you ask or isn't, you know, taking things on board. But
it's
you
finding
don't know
out the
until,
way.
Exactly. You don't know until you don't know what you don't know.
No.
And parent carers are dealing with more than I think any therapist possibly can imagine.
Yeah.
And I think our passion within Born at the Right Time is that the lived experience coupled with the evidence and the data are the things that bring about the transformation that you have talked about, really caring about from Seating Matters and the 24-hour postural care. That it's with that combination of people's lives and what we know from the evidence and the data and the information that we can do things that make a lasting change, not just in our behaviour, but in our attitudes and in our perspective. And that, for me, I think lots of the recent research, unfortunately, is coming up around parent care trauma and the way that systems are unwittingly generating trauma in parent carers through sort of the policies and the hoops and the tripwires and tight ropes that they're expected to navigate. And I think it could be done better.
Yeah. Because you mentioned as well, you know, how many people you've had contact with because of Sam.
Yeah.
So was that, say, over from in his lifetime, or? No,
I did a little experiment. So it was during COVID, and I was sitting in the garden, and I wanted to do a picture of everybody that I needed to communicate with about Sam. And I think it probably was more prominent because people weren't coming into our home. Then all the emails, all the phone calls, school wasn't navigating and all that stuff. All of it was coming to me.
You.
And so I sat down and I included some of the, you know, the receptionists I speak to whenever it's, you know, drop off or pick up, or the bus driver, or the PA within the minibus, or, you know, the after schools person, or the holiday club person, or this TA, or the, you know, the teacher, all those people. But then I also included the local authority, and with the person who did the payroll through the tertiary, the direct payments, and then the social worker, and then there was the charity people that we'd got the bed from, or the specialist equipment from, and then there was the specialist services, the consultants and the neurologists and the specialist physios and the specialist OTs, and then there was the equipment providers, whether that's through the equipment service, but it might be the person that's dropping off, or the person who's ordering the syringes or the pads or whatever else. And when I sat down and I, you know, labelled all these printed out people, there was over 80 people that I had to communicate with. Now my friend Sahar, who is a Syrian refugee, been in this country for 10 years now, she's got English as a second language, and she doesn't know how to navigate the system the way I have the privilege of navigating the system. And her network of people isn't as big, but her son's needs are more complex than Sam.
Because she doesn't really know how to navigate or how to reach.
She doesn't know.
And how much more difficult it is for her.
Absolutely. And how she doesn't know what she's eligible for. And she's just incredibly grateful when she gets anything. And she will, you know, they say jump and she says how high. Because she's just so thankful that services, but even when they're not meeting their statutory duty or their legislation, and she's backwards and forwards to the wheelchair service, or unable to get the, you know, they refuse to do the ceiling track hoist in the bedroom for a while, or just all sorts of things that I, you know, but she sometimes messages me and says, you know, can I come over and we can do a phone call? Because she doesn't have the confidence yet on the phone. Her English is brilliant. But it's just having that confidence, because it's a different language, isn't it? It's all the jargon words, and it's sometimes someone speaks really fast on the telephone, or, you know, she's happier face to face than she is on the phone. So I think there is a complex web of people around families, and we can assume that that's support, and sometimes it's not, it's just involvement. But we need to recognise that involvement is translated into support when we're coordinated, when it's person-centred, when it's the priorities of the family, and we need to recognise our own biases and structural biases and prejudices that
Yeah.
make it harder for certain minorities within that group of disabled people, find it even more challenging to navigate services
Yeah.
and get what they need for their loved ones.
So there was a phrase come up today at the conference which I'd never heard before, and it was chronic sorrow, and it really resonated with me, and I began to think about it. So, and I know it's more relevant to you as a parent. So tell me about chronic sorrow.
So I came across chronic sorrow a couple of decades ago, but Rue's research published around it is around thinking about chronic sorrow as a normal reaction to irremovable loss. I think when we think about bereavement and loss and grief, typically there is something that happens that just changes your life inexplicably. You lose somebody who is pivotal and loved by you, and your life is never the same again. And then your life grows around that loss and that grief, and it starts to fill again, and it doesn't go away, but it gets absorbed by a growing world again, new relationships, new experiences. But what happens, I talk about it within my training, is like you fall into this rabbit warren of disability where you get diagnosis after diagnosis after diagnosis. I remember the day they talked about doing lying support with my son. I just slumped into the chair in the toy library where they were supporting parent carers, and I just said, there's nothing that escapes this disability, Lark. You know, I'm being told how to feed him, I'm being told how to sit him, I'm being told how to bath him, I'm being told how to put him to bed. I can't do anything. And the chronic sorrow is like this, is like a term that's trying to encapsulate, yes, there is this thing that happens and there are repeated traumas that occurred, but the fact that you live a life and you walk down a route where there's this other hologram of a life that you would have maybe had with a young man who could walk and talk when his cousins are getting their GCSE results and he's not getting his GCSE results, when they're passing their driving test or getting engaged or whatever it might be. And the chronic sorrow comes from the duality, the reality of being so utterly proud and adoring my boy, my young man now, and yet still living in a life where it is utterly different from what I planned. Still 21 years later, you know, I didn't plan to have 16 people in my house, you know, watching me with bed hair and snot across my face first thing in the morning when I've just climbed out of bed. And so chronic sorrow is that ongoing. So you might have a simple word say to you in a hospital clinic appointment, and it can fling you back to the diagnosis, or it can throw you into the point at which they said for you to stop feeding him because he was silently aspirating, or the phone call you made with the first seizure and calling the ambulance. And chronic sorrow is this kind of under the surface, constant navigation of really challenging, big feelings that can feel quite opposing. And it's what families are navigating all the time. And sometimes we push it right back, and sometimes the simplest of thing can
just brings it back up to the surface. So it is very much like grief. It is grief.
Yeah, it's a kind of grief, but it's just this ongoing. Because we don't evolve away from the loss. No, it just becomes more entangled.
That's right.
It becomes bigger. It envelops our life even more. Rather than the separation, we kind of dive into it.
Rachel, it has been a pleasure talking to you, and very interesting. And he came into a good family anyway, Sam. He's been sounds as if he's been truly well looked after, and his needs have been met, and you're going to make sure that continues, along with a lot of other people who need your help. So I'm sure they're very grateful to have you on their side. So your podcast, just recap again, is The Skies We're Under. The Skies We're Under. And your book is called
The Skies I'm Under.
The Skies I'm Under.
And the business with the training and the parent care workshops so practitioner training is born at the right time, and we do training on postural care, we do training on communicating and working with families, and we do training on parent care and trauma.
Right. Well, thank you so much.
you.
That's all very good.
Lovely to speak to you.
Thank you, Rachel.